Welcome to my YouTube channel. Our today's topic for discussion is metformin, an oral anti-diabetic drug in the biguanide class. Dosages and indications: slow and low. A low initial starting dose to reduce the risk of ADIRs, especially GI-related issues. Slowly titrate and build up. For type 2 diabetes, standard release. 500 milligrams with breakfast for at least 1 week. Then 500 milligrams with breakfast and evening meal for at least 1 week. Then 500 milligrams with breakfast, lunch, and evening meal thereafter. Max dose of metformin is 2 grams daily in divided doses. For type 2 diabetes, modified release, initially 500 milligrams once daily. Then increased if necessary up to 2 grams once daily. Dose increased gradually every 10 to 15 days. Dose to be taken with evening meal or 1 grams twice daily. For polycystic ovary syndrome, initially 500 milligrams OD. Max dose 1.5 to 1.7 grams daily in 2 to 3 divided doses. Adverse effects of metformin: low vitamin B12 levels, common ADR. May reduce B12 levels with prolonged duration of treatment, lactic acidosis. Symptoms can include abdominal pain, anorexia, hypothermia, lethargy, nausea, respiratory distress, and vomiting. Avoid if eGFR is less than 30. Increased risk: GI ADIRs, nausea, vomiting, diarrhea, abdominal pain. Common at the start of treatment, may subside with time. Consider switching to MR preparation if troublesome. Adverse effects also include taste disturbances, skin reactions, reduced appetite, weight loss. Drug monitoring includes, before commencing, estimated glomerular filtration rate. If estimated glomerular filtration rate is less than 30, do not commence. During treatment, estimated glomerular filtration rate. At least annually or at least biannually if risk factors for renal impairment. B12 levels. Consider periodic vitamin B12 monitoring in patients with risk factors for vitamin B12 deficiency. Renal impairment for metformin. Estimated glomerular filtration rate is 45 to 59 milliliters per minute. Maximum dose will be 2,000 milligrams daily. Estimated glomerular filtration rate is 30 to 44 milliliters per minute. Maximum dose should be 1,000 milligrams daily. If estimated glomerular filtration rate is less than 30, then metformin is contraindicated. When not to initiate in those at risk of lactic acidosis. 1. Diabetic ketoacidosis. 2. Estimated glomerular filtration rate is less than 30 milliliters per minute. 3. Risk of acute kidney injury, dehydration, prolonged fasting, severe infection, shock. 4. Hepatic insufficiency, acute alcohol intoxication. Counseling advice for patients: 1. Patients prescribed metformin should be counseled on this risk of acute kidney injury. 2. Administration. Take with food or after a meal to help with GI adverse effects. 3. Duration, usually lifelong. Drug interactions include: 1. Alcohol, risk of lactic acidosis, especially with excessive consumption. 2. Beta blockers may mask symptoms of hypoglycemia. 3. Guanfacine may increase metformin concentration. 4. Cimetidine may increase metformin concentration. Question time. You have commenced Mr. Glucophage on metformin to help manage his type 2 diabetes. The starting dose you have prescribed is 500 milligrams once daily for the first week. Then 500 milligrams twice daily for another week. Then 500 milligrams 3 times a day. How many 500 milligrams tablets would need to be prescribed? For the first 28 days of treatment, a 28 tablets, B 56 tablets, C 63 tablets, D 80 for tablets. Comment down your answer below.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.